Hi guys, welcome back to another video. In this episode, we're going to look at a patient that had bilateral frozen shoulders, otherwise known as adhesive capsulitis. So it's beyond shoulder pain that limits motion. In adhesive capsulitis, the shoulder is truly stuck. So in a normal shoulder, if you keep the shoulder girdle from moving, your shoulder should be able to come up to 180 degrees. When a person has adhesive capsulitis, this doesn't happen. The joint is actually frozen to the point where you're going to have a decreased range of motion. So in this patient, both her shoulders would only come up to right about here. And medically, this is a very hard condition to fix. In the medical world, basically they'll tell a patient it can take 6 months to a year to resolve, if it's going to resolve at all. And a lot of times it does not. In chiropractic, a lot of times we can help these people in several months. This patient had an amazing recovery. She was out of pain in a matter of weeks. That is not typical. These shoulder problems are very, very tough to fix, but she had a great and amazing outcome. And in chiropractic, we don't treat any specific condition. We just get to the root cause of why she had this. And oftentimes it's a pinched spinal nerve coming from spinal damage somewhere that went untreated. Now, in addition to these shoulder issues that she also had severe low back pain going down the back of her leg. So we're going to take a look at her again to see what she's got going on. She's already been pain-free for a bit of a time, but she's going to tell her story, and we're going to take a look at her to give her another adjustment to make sure she stays that way. Because the spinal weaknesses and these pinched nerves that we find, a lot of times they're not going to stay gone forever because there's hardly any tissue in the body that heals up to 100%. So if a patient doesn't maintain it or come back for regular checkups, just like you would with your teeth, if you don't get checked regularly, you will get cavities and you'll get tooth decay, and the spine is no different. So if you don't keep up with the care on your spine, the same problems can return. You can get new issues, and we just don't want that to happen. People invest a lot of time and money into getting fixed and to get their health back, and they want to keep it that way. So let's take a look. Thanks. Okay, so today we have Miss Julia, and Miss Julia came in with some bad shoulders, a problem called adhesive capsulitis, otherwise known as frozen shoulder, and that's literally when the shoulders don't move. So normally her shoulders should come up to 180 degrees when you hold the shoulder girdle down. The ability to raise your arm above your head comes because after 180 degrees, the whole scapula will rotate up. So in people with adhesive capsulitis, when you try to raise their arm, it will only come up to a certain percentage, but not all the way. So when Miss Julia came, she couldn't raise either arm much higher than that. It was just stuck. So on top of that, she had low back pain and it was going down the back of her right leg. So Julia, tell me how long you've been dealing with that and kind of how bad it was.
It was severely bad. I have been dealing with it for a couple of years, actually. My husband and I bought a adjustable bed because we were both suffering from back pain, and I literally could not even sleep in the bed.
Look at it. A couple of years.
Yeah.
So yeah, medically, if you go to a medical doctor for adhesive capsulitis, they'll tell people that on average it'll take 6 months to a year to resolve, if it does at all. And as you can see with her, 2 years have gone by, she'd been still suffering with it. And that's not uncommon. And with chiropractic care, historically, I see it, typically bad cases take about 3 months, but it can take longer. But she had an amazing response. Tell them about your response here.
Literally, it was maybe a month and a half, and I was able to sleep in my bed for the first time. Brand new bed.
Yeah, because you were sleeping in a recliner, right?
Yes, I have been sleeping in a recliner for 2 years.
2 years in a recliner?
Yes.
Oh my gosh, I couldn't imagine sleeping in a recliner for 2 years.
Now I can sleep in my bed, I can sleep on my back, on my sides, normal sleep. It is awesome.
So it's been a few weeks since we've seen Miss Julia. She's here for a follow-up. She reports she's a little tender down low. So these weaknesses that we find, so with her, and commonly with adhesive capsulitis and shoulder issues in general, it's going to be a lot of times the nerves actually supply the shoulder. So that's this whole region. So anything in this region can really affect that. And when we hone in on her problem, it was the one right here at the base, 7th cervical. But it doesn't always have to be that one. So you can't, in chiropractic, we don't just cookbook it and say it's always C7 or something like that and just adjust that. In the Gonstead method, we do a specific exam every visit. And that way we know exactly what needs to be adjusted. And when we don't need to adjust anymore, we leave it alone. Because it's just as important for a chiropractor to know when to not adjust as it is to adjust. And the other problem she had was right here in her mid-back. I'll show you her x-rays in a minute. But she has some pretty big postural distortions in her back because of the disc damage. So from the front of the back, that spine should be perfectly straight. But what happens is when those discs get damaged, you can get that little jelly center to kind of shift and it makes it sit kind of cattywampus. So we'll take a look at that and it'll be very obvious on her x-ray. So yeah, she's got a lot of muscle spasm back up here from that area. And her low back issue was down here on her sacrum. Okay, let's rock back and forth and check the motion. Yeah, still that's locked up again a little bit. And that's why we check it, because these things will start getting locked up and start to swell before the patient's back in a lot of pain. So we make sure we check them enough to make sure that doesn't happen. Okay, so what we found on Miss Julia today is very typical of what we found in the past on her. If it was different, I would adjust different things, but today it happens to be her 7th cervical, and then down a little lower around that 7th thoracic, and then on her sacrum as well. So we're going to get her adjusted up and get her back doing good. Okay guys, now this is the x-ray of the patient that had the frozen shoulders. So to kind of go over what we found on her, we check her from head to toe, but if you'll look, her spine is not straight. It's not too bad, but down here in the low back, you'll see that it kinks right about here. Then as it comes up, it straightens up. Right here in the mid back, you'll see that it kind of deviates this way. Then up here, it deviates this way. So when we come to shoulder issues, the nerves that supply the shoulder come out of this general region. And what happens is when the nerve is being irritated, it will affect the shoulder in ways. It can affect the muscles, it can affect the shoulder chemistry, and it result in that adhesive capsulitis. So for this particular patient, the areas that had the most impact on her were up in this region here at the base of her neck, and down here in the mid back where it deviates this way. Now for the low back pain and the pain that was going down the back of her leg, we found the problems down here in the sacral area. A lot of times that can come from anywhere down here below, but her particular problem was down here, and she responded great. Okay, Mrs. Julia's got her 7th cervical here. I'm going to adjust it just how that x-ray tells me to. Chin down just a little bit. I'm going to bring this hair back for you. Down. Turn it in a little bit. Bring it up just a bit more. Perfect. Great. That was a good one. All right, for this one. Yeah, it's pretty swollen today, and a little tender. Real specifically. In the Gonstead work, we're very meticulous about our context. We don't just randomly manipulate. We get precisely on that vertebra exactly where we're supposed to contact and making sure we're not on more than one vertebra. Just relax your shoulders a little more. There you go. Perfect. Okay, that was good. I'm going to bring her up. I'm going to do one more. There you go, Miss Julia. So keep that bottom leg straight. Then the top one, very good. Arm back. Scoot your hips towards me just a little bit. Perfect. Just like that. A little towards me. Right there's the one we want. Okay. All right, move really towards me. You're not going to fall. Just let go. Perfect. Great. All right, come on up. All right, so we got Miss Julia all adjusted up, so I'm going to come back and I'm going to recheck those areas that we worked on, make sure that they're moving. That's the main thing, is that if the joints aren't moving, they're not healing, so the muscle spasms, so they're there. Let's rock back and forth. That's definitely better. Now let's rock it back and forth down here. Excellent. Very good. All right, guys, that's a great case. Like I say, don't think by the video that every case gets better that fast, but she did awesome. And and that's just I've been in practice 20 years, a little over 20 years actually, and I'm still amazed at how fast the body will heal if it's just given the chance. So thank you so much for watching, and we'll see you on our next video. Take care.